There's a new option in the war against opioids. A new minimally invasive surgery is proving effective in reducing and even eliminating the need for opioids in some patients. Barbara Morse Silva has the details.
David Crosley is about a month out from surgery.
Prior to the surgery, I was lucky if I could do 2,000 steps in the course of a day.
That was because of chronic back pain.
Yeah, I had 3 back fusions done, and after having the back fusions done, I had some permanent nerve damage.
And in addition, he was requiring pain medication to control this pain. We tried some conservative treatments, including cortisone injections and some more physical therapy. However, unfortunately, he continued to be symptomatic.
Then David heard about something new from Dr. John Servian, something innovative. What he heard, he liked.
I was like, well, let's sign me up because I didn't want to be in pain anymore.
So about a month ago, David had what's described as the world's smallest wireless device of its kind implanted through a standard needle.
And basically what we do is we'll place it down through the skin, and again, this is done with X-ray. We'll place it within or around the spine where we would like it. The wire is underneath the skin, and then it works remotely. So the impulse goes through a little battery pack, and that impulse goes to the wire, into the wire, which in turn is part of the process and the science behind it relieving pain.
Feeling anything, David?
A small battery pack worn on the outside in a pocket or clipped to a belt is programmed and sends impulses to the device to control the pain.
And the beauty of this is we've had very good results with it, and fortunately it has significantly decreased the use of opioids.
For David, it took just 1 week.
By the end of the week, I was actually in a lot of no pain. I was like,
were you
this
shocked?
is working. Yes.
And now, no opioids.
Getting off of it was a plus, especially in today's day and age with all the opioid epidemic and everything.
The device is called the Stim Wave Freedom Spinal Cord Stimulation System. Dr. Servian says it could also be used to control chronic pain after a broken arm or total joint replacement. A new study reveals a major shortage of therapists trained to treat children with autism, especially here in Michigan. We talked to Residential Options Incorporated today, which is a local learning center for children with autism. They say they struggle to find certified clinicians to meet the local demand.
Having services available in those after-school slots are the most difficult times to see kids and to provide treatment to them. And so we have long waiting lists for that time of day. And so it is more difficult.
Residential Options Incorporated says they've been able to grow despite these issues. They encourage those looking into going into any therapy field to consider working with children with autism.